My today's topic is cancer, important concepts and clinical experiences. Next. So some part which I was going to present is already discussed by the previous speakers. But among Vaidyas there is always a discussion that whether cancer is a new disease or it can be considered as a specific condition of diseases described in Ayurveda. Vaidya Bhalchandra Shastri Nanal, who was a leading practitioner of Ayurveda in Maharashtra and all over the country, he was of the opinion that according to his opinion, cancer can be understood as a specific condition of around 16 diseases described in Ayurveda. This was his opinion. In certain types of cancer patients, we find quite a similarity with the diseases described in Ayurveda. Whereas in certain cancer patients, it is not exactly, it cannot be labeled as a particular disease in described in Ayurveda, because it can be in the process of samprapti of that disease also. So, according to Gadgil sir, who is also renowned, our guru and renowned practitioner of Ayurveda, and he has also treated a lot of patients of cancer. As per his opinion, both these things we have to consider. At certain point, we find that it is a specific type of disease described in Ayurveda, but as a new entity also sometimes we have to try to understand from Ayurvedic perspective. Next. As already discussed by sir, many Vaidyas correlate cancer with Arbud, but not in all patients we find symptoms of Arbud. For example, blood cancer, there we don't find. In many patients we don't find exact picture like Arbud, but in certain patients we find picture like Arbud. So certain aspects about Arbud. Next. Vataja, Pittaja, Kaphaja, Raktaja and Mausaja, all kinds of Arbud are described. Next. Raktaja Arbud is described in this way. Next. And Mausarbud. In this, certain aspects which are mentioned about Arbud are like Mushti Prahara, etc. That means injury, stress on specific part of the body, and there Arbud develops. It is described. Similar thing is observed in many patients of cancer. Next. Now in Arbud, they have described about Adhyarbud and Dvirarbud. So further development of Arbud. So something similar to metastasis. Next. 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 In Upadrava of Vatarakta, Arbud is mentioned, and Jamadagni sir is specifically of the opinion that this is very important while treating cancer. That Vatarakta we don't take into consideration while treating the patients of cancer. But he says that Upadrava of Vatarakta is described as Arbud. So that's why in certain patients, this kind of samprapti also we have to take into consideration. Next. Now this is also very important, like I mentioned, that Arbud, how it increases. It is mentioned that Ghattana, that means constant pressure on particular part of the body. Chinna, when it is injured, cut is there on that part of the body. Mruditam, when it is pressed, then Arbud increases at that site. And this kind of samprapti is observed in many patients. And Vaidya R.B. Gopte sir, he was of the opinion that this is one of the most important aspects of samprapti in cancer patients. And in many patients we find that at that particular site, when constantly irritation is there, then there the body, because what happens due to all these things? Next. Due to atilekhan, pedan, ghattan, mardan, etc. What exactly happens is that Rakta Dushti takes place at that site. Sarvadhik, Shukra and Oj they are hampered. Then suddenly Dhatukshay takes place and Dhatukshay-janya Vat Prakop takes place, and that is Achaya Purvak Vat Prakop, because suddenly it happens. And Dosh Kshayatmak Samprapti takes place over there because of the constant injury over there. Dhatukshay-janya Vat Prakop takes place, and Kshayo Vruddhestu Pidana. So the body tries to protect that part by making udiran of doshas from other sides of the body over there, and that is how sometimes their abnormal growths take place. So this kind of samprapti. So that's why this is also one important aspect, and that can be observed in many patients. Next. In Ayurveda, according to specific site which is affected, different types of arbud are described, like Karnarbud, Nasarbud, Vartmarbud, Mukha. Under Mukharog also arbud is mentioned. Next. Kanthagad Galarbud, Talu Arbud, Mukharbud, Kapalgat Shiro Arbud. Like that, various types are mentioned. Next. And now, if you will take a look at the top 5 cancers in men and women in India, the sites which are mentioned in Ayurveda about specific sites where arbud are developed, similar sites are observed under these lists of top 10 or top 5 cancers. Next. As you know, lifestyle changes are very important, which lead to such diseases like cancer. And in our text, in Rasayan Adhyay, they have mentioned that this kind of changes happen in the lifestyle, in the diet and activities of people. And that has led to so many diseases. Next. I will not explain about each of these factors, but these things are observed today even more. They have mentioned it long back, but now it is even more observed. Paryushit Bhojan, Visham Adhyashan, etc. And what happens due to that, the effects of that which they have mentioned, that Shithili Bhavanti Mausani, Vipunchante Sandhya, Vidayate Raktam, and here we find the origin of so many so-called newer diseases which are observed here, like muscular dystrophies. So Shithili Bhavanti Mausani, or joint disorders, Vidaha in Rakta. Vidagdhata means Pakwa. So sometimes in Rakta, immature cells are originated. That also can be like a Vidagdhata. So that way, Vidayate Raktam. Vishandatecha Analpam Medaha. Vishandan, and it spreads. Vishandan means oozes and spreads to different parts of the body. Like that, various effects which they have mentioned, they can be responsible for the origin of certain newer lifestyle disorders which we are finding around us. And the answer is here. And the answer for that, they have mentioned that this was the diet and these were the activities which were responsible for the origin of these kinds of diseases. What changes occur due to that, they have mentioned in this paragraph. And what is the solution for that? All this we find in Rasayan Adhyay. So the Rasayan, even before the disease originates and even after the disease originates, is important, and that is one of the important solutions which we already have. Next. So when abnormal growths take place in our body, obviously in terminology of Vat Pitta Kapha, we will try to understand that. So Vat is responsible for Sanyoga and Vibhag. So abnormal Sanyoga and Vibhag, and abnormal Vyuhan, arrangement of the dhatus, is responsible for abnormal Vriddhi. In Pitta, abnormal Pak, Parinaman, and due to that Vikrut Vriddhi, that can happen. And Kapha is responsible for Vriddhi, Shleshmananugata Vriddhi, and that's why Vikrut Kapha will be responsible for Vikrut Vriddhi. So in our patient, what has happened? That we have to find out, and accordingly we will decide our line of treatment. So it is told that Sharir Avayavastu Parmanu Vedana Aparisankhya Bhavati, and Tesham Sanyoga Vibhage Parmanunam Karanam Vayu Karma Swavascha. Next. Vat is responsible for Sanyoga and Vibhag, and therefore abnormal cell division or abnormal increase in cells, for that also Vat is very important. And in commentary, one very interesting thing is given, that not just Vayu, but Vayu karma swabhav parigrihita Vayu. So because of the effects of previous deeds, Vayu performs specific Sanyog and Vibhag. Now some people may find it controversial that in cancer patients, Purva karma has to be responsible, or can it be one of the factors? Many patients we find, for example, one lady, she was having breast cancer, old lady, and she wanted only Ayurvedic treatment for that purpose. And we were treating her and we were finding that the growth is decreasing. It considerably decreased. And one day suddenly she had a fall, and exactly at that site only injury took place. Again there was further growth because of that. So again we started our treatment, again somehow the growth started reducing. After some days it was considerably reduced. Again she had a fall and at the edge of the table, and again that injured the same site. Now what you will say? How this is happening? So has to be something related to the past deeds. That why only at that site only injury is taking place. So like that we find patients, and then we will have to say that okay, this also can be one of the factors. Although we are not performing Daiva Vipassana Chikitsa much, so we can't do much about that. So, but if we find that this is the factor, maybe we will refer them to some people who are experts in Daiva Vipassana Chikitsa and real experts in that field. Because there are many people who make fool of people pretending that they are experts in that field. So, real experts, if we know, we can refer to them. Next. So, I already have told that Shleshmananugata Vruddhi, and therefore Vikrut Kapha can be responsible in many times for abnormal growths. Next. In Vata, they have mentioned one Bahuguna, and due to Bahuguna, multiplicity takes place, but quality may not be the same. It may be abnormal quality. The same thing happens at many places, in many diseases, even these which we are observing today. But that Bahuguna has to be considered, and therefore Vata has to be controlled. In cancer patients, actually we find that all three doshas are involved. Which one is dominant, only that we have to decide. All three doshas are involved. And if you will see the patients, how the treatment goes, if you will try to only kill the cells and destroy that growth, then as I told, when you try to make injury to that starts growing with a faster speed. That is also observed. So without causing Dhatukshay, without causing Dhatukshayjanya Vat Prakop, we have to reduce that growth. So while reducing that growth, we have to also take care that the normal Dhatus are not injured and Dhatukshayjanya Vat Prakop will not takes place. And that's why it is not so simple. No? Otherwise anybody will, okay, to destroy the cells, what we can give? Immediately somehow people will start the treatment and everybody will start getting good results. Means everybody should get good results, but why we are not getting? Because this we have to remember. Next. Sharirasya abhinirvritti and abhivruddhi is rasaja bhav. So rasa is also involved. So rasa dushti can be very important factor in many patients of cancer. Next. And it is also said that tesham kshayavritti shonita nimitte, and importance of rakta we cannot forget. And in utpatti of majority of organs, in according to Ayurveda, rakta plays important role, and that also explains, that also gives us one way to think that how metastasis takes place, why from one particular organ to another organ, what is the correlation between these two organs, why from this organ to that organ. Now I am telling here some in general concepts about cancer, which can be very practically very important. But about specific cancers, that in specific cancer, what exactly happens, if we will see from Ayurvedic point of view, that some around 2 years back, I had given about top 10 cancers. I had given one write-up to Ayurveda Rasayani about how exactly from Ayurvedic point of view that samprapti might be taking place. Next. Shukra, Sarvadehik Shukra is also very important. Shukra which goes out and makes fertilization, that starts a new life. But experienced Vaidyas, they say that Sarvadehik Shukra is responsible for new growth, new developments in the body. So that's why if abnormal growth is taking place, then also Sarvadehik Shukra and Oj we have to consider, and that also we have to protect, and it has to be proper. Now every such thought, then we will find specific medicines. So that's why Shukra Shodhan Gan some Vaidyas are using in their practice for treating patients of cancer. Therefore. Next. Important functions of every dhatu in dhatu nirman means all the dhatus, how they develop. For that, every dhatu is playing some important role, and that has to be considered in abnormalities also. So rasa, we already know that pridana and poshan. So nourishment to any normal or abnormal growth will be from rasa, and therefore if abnormal growth is taking place, rasa dushti has to be considered. Jivan is important function of rakta. That means to make to dhatu parmanu, to keep them alive is the function of, and for that whatever is required. That means if injury is there, healing of that wound, then increasing the size, shape and size to normal level. All such activities which are responsible for survival of that specific parmanu is related to rakta. And in cancer cells, what we find that the cells which should have died, they also keep on surviving. So that means maybe Jivan Karya of Rakta is having Vikruti, and therefore Rakta also is having very importance in treatment of cancer. So if Jivan Karya Vikruti, and therefore those Paramanu which have to die, they are also surviving. They also keep on surviving. Then Bruhatva Akar Bhar Vriddhi is related to mouse and med, and additional function of med is Snehan. So if we find that large size, increase in size, large size, then mouse and med has to be considered in that abnormal growth. So in cancer also. Drudhatva Sthiratva is related to Asti. So if hardness is observed and it is enduring, it is surviving for a very long time, then Asti has to be considered. This all what I am telling is very important, because accordingly we will have to select our medicines, that which dosh and which dusha, on that our medicine should act. Accordingly we will have to select our medicines. Then Majja Samvedan and Snigdhatva and Sarvadek Shukra Nutan Utpatti. So accordingly we will have to understand that what is happening in the body and it is related to which dhatu. Then accordingly our medicines we have to select. Next. And as already mentioned by Kadam sir also, that Agni we cannot forget in treating any patient, chronic to even ICU patients. Agni we cannot forget. So here also Agni we cannot forget. Agni, now when we become hungry, that time functions of Agni are increased. We eat food and the food is digested. Later on the functions of Agni, that means they are minimized. Because the Agni, it will keep on digesting, then it is said that it will perform Pachan of the Dhatus also. So that's why by increasing Saumyansh, Apyansh, the functions of Agni are controlled in the body. So therefore, Sad and Deepti are normal processes about Agni. Same way, Sad and it is in Das Pandit commentary, it is told that the same thing happens with Dhatuvagni also. So Sad and Deepti happens in case of Dhatuvagni, and it is normal process. But Atisad and Atidipti are abnormalities, and that can lead to, Atisad can lead to Vikrut Vriddhi, and Atidipti can lead to Vikrut Kshay. So Atisad, so Dhatuvagni Mandya can lead to Vikrut Vriddhi, and that's why in many patients we have to find out which Dhatu is involved, and if Parinaman of that Dhatu we can improve, that means that Dhatuvagni we can target, then that abnormality we can control. So that's why it is very important. And I have taken references from various eminent Vaidyas. So there was one famous book on cancer or Ayurveda written by Vaidya Ram Singh Gohil. He was practicing in a small village Bichia near Rajkot, and he was so much successful with his cancer treatment around some 60-70 years back, that he had built one hospital for cancer treatment through Ayurveda and in that village. And patients from different countries were visiting his hospital at that time. So he was a very successful practitioner. So he has written a book, his thoughts about cancer and his experiences about cancer. And in that what he has said, that Dhatuvagni Mandya is one very important factor which can lead to such abnormal growths. So that's why we have to consider that which Dhatu Agni Mande is there. Accordingly, if we can act on that Dhatu Agni, then that growth can be controlled. This Vaidya Ramsingh Gohil also wrote his experiences. According to him, he found that 11 dravya, that means 11 single drugs, according to him, are most important in the treatment of cancer as per him, as per his experiences. And as per his experiences, Rohitak is most important medicine in the treatment of cancer as per his experience. So we are also using Rohitak or Rohitakarishta or Rohitakasav in many patients, and that is acting on Rakta and mediated through Rakta to prevent metastasis. Also it is helping a lot. Next. So for Parinaman of any Dhatu, in Charak Samhita they have given that Anupahata Sarva Dhatushma Maruta Srotaha. So Dhatuvagni, Dhatuva Srotas and Vat, which Vayu? Vyan Vayu. So Vyan Vayu performs Vyuhan of the Dhatus. So these three factors are very important. Nutrition to that Dhatu is important, and for Parinaman of that nutrition, three factors are important. Dhatuvagni, Dhatuva Srotas and Vyan Vayu. So Parinaman of any Dhatu we want to correct, then at least these three. These three are most important factors. There are many more factors described in the text, but these three are most important. So we have to understand whether Dhatuvagni is not functioning well, Dhatuva Srotas is not functioning well, or Vyanavayu is not performing the Vyuhan properly. Accordingly, we'll have to treat the patients. So even in abnormal growths, abnormal spread of that, Vyanavayu is responsible, and that's why our medicines also should be given in Vyan Kal, that means after food, such medicines. So Aushad Sevan Kal also accordingly we can decide. So therefore Vyanavayu is very important in this regard. Next. Vyanavayu, its function is described as Dhatu Vyuhan, and that is Dhatu Rachana and Dhatu Vahan. That means transportation of the nutrients and arrangement of the Dhatus. That is Vyanavayu, and that's why functions of Vyanavayu are very important for controlling abnormal growths. Next. Then Utpatti of Avayav. Why specific organ had this cancer in it? Why abnormality in this specific organ? And so therefore Utpatti of that organ we have to see, and accordingly we can select medicines. That means Utpatti is related to certain Dhatus. So we have to select medicines which will be acting on that specific Dhatu. So from Rakta, Yakrut and Pliha. Next. Rakta Phena Prabhav Pupus, Rakta Kitta Prabhav Unduk. All this is also very important. So how Rakta Kitta we can improve, and how Rakta Phena we can improve, and how Rakta Sara we can improve. Rakta Maus Prasadat Antram, Prasadansh. How we can improve. So if Antra are involved, Rakta and Mouse, their Parinaman we have to improve, and how Prasadansh can be developed over there. That we have to think. Just like Kadam sir mentioned that some these abnormal growths may, if they are not given a chance, they will get destroyed on their own. We have got Swabhava Paramvad. And with the Gadgil sir, what he thinks that according to Swabhava Paramvad, everything gets destroyed on its own. Everything which is produced will get destroyed on its own. But what is happening that it is replaced by new things which are produced, and that's why it continues to be there. So that's why for Utpatti Hetu are required, but Vinash Hetu are not required. So that's why abnormal growths can decrease on their own. But what is happening that the place of that abnormal growth is taken by another abnormal Dhatu. So we have to stop abnormal Dhatus from taking place of that, and that place should be taken by normal Dhatus. And that's why Hetu are required. So he said that we should concentrate on producing normal Dhatus. Then the abnormal Dhatus can be destroyed on their own. Like that. This is also very important. And that's why he keeps the patients on cow's milk or grita, etc. So that good quality Dhatus are produced. Producing Dhatus is in our hands, and they will get destroyed on their own. This is also an important concept. So for producing good quality Dhatus, we should be knowing specific organs are involved, to which Dhatus they are linked, and accordingly we can give specific medicines which will be acting on those Dhatus. Next. Next. So accordingly, we can select specific medicines which are acting on specific Dhatvagni. So once whole Bhavaprakash Nigantu I took and I tried to, this is just a few examples I have given here. Whole Bhavaprakash Nigantu classified under this, that on which Dhatvagni which medicine is acting. Certain medicines are acting on multiple Dhatvagnis also. So Gokshur is that, and Bhutagni also. Indra acting on Rasa Dhatvagni, Katuka Rasa Dhatvagni, Kirattikta Medo Dhatvagni. Here I have taken help of books of certain eminent Vaidyas like Dravyagun Vidyan by Padke Shastri. He has also given certain points, and adding to that from my experiences or from experiences of some other gurus, I have prepared a complete list like this. So from this list we can select specific medicines and what we are expecting to do there. So we also can get a list of specific rasayan acting on specific parts of the body. Specific parts of the body and specific medicines acting on specific parts of the body. Like that I have already made a compilation. That specific part of the body, Prushtha, which medicines are acting on Prushtha. Vrukka, which medicines are acting on Vrukka, Basti. Like that, specific parts of the body, which medicines are acting. And that is very helpful while treating cancer patients, because that specific organ, we have to make some changes over there. So specific Dhatvagni and specific this. Next. Specific Rasaushadhi are also acting on specific Dhatu. And why Rasaushadhi? Because Rasaushadhi, they quickly make these changes and long-lasting changes they make in these Dhatus. And that's why these are the specific medicines. The Kalpa I have given as examples, and these are all examples. This is not a complete list. But for acting on Rasa, Yashad and Kharpar are most important medicines, and that's why Lagumalini Vasanta is one important Kalpa. For Rakta, Tamra, Kasis, now recently one diary of Ayurved Vyaspit is published, and in that I have written a small article on Kasis Basma, how it can be used. So Kasis Basma performs Am Pachan also, which Makshik, Loha, etc. Makshik up to some extent it is doing, but Loha, Mandur, etc. they are not doing Am Pachan as such. But Kasis is doing Am Pachan also. Kasis is removing Srotorot, and still it is giving nourishment to the Dhatus. So therefore in cancer treatment also Kasis is very important. Kasis performs Lekhan of Vikrut Vriddhi also, but at the same time it is giving strength to the normal Dhatus also. Both actions it is performing. So Kasis is one important. So like that we have to find medicines which can be useful in cancer patients. Nowhere such a list is given as such in Ayurveda, because the word cancer itself will not occur in any ancient text. So we have to take an approach and study accordingly. So Kasis is one important medicine accordingly. For like that we have to think Manjishtha acting on Rakta Dhatvagni. Manjishtha performs Pachan at the level of Rakta, but Manjishtha is also performing Shaman of Dhatukshayajanya Vat. So this is exactly required in cancer patients for us. So Manjishtha is also therefore we will add to the list. This is one important medicine useful in cancer. Like that. Vruddha Daruk is very good Ampachan, and it is acting on Mutra Marga and Shukra. It is very good Ampachan, but at the same time it is Rasayan and Balya also. So therefore add to the list. This also can be very useful. It will therefore control the Vikrut Vriddhi, but at the same time it will give strength to that Dhatu also. So like that we can prepare a list. So Mouse Tamra, and therefore Lagumalini Vasanta Kravyadras is useful for Ajirana of mouse or Ati Guru Ahar. So if Ati Guru Ahar is Hetu, and in Arbud Mouse 7 and Ati Guru 7 Ahar 7 was mentioned as Hetu, and for that purpose Kravyadras is a specific medicine. ते बऱ्याच वर्षाआधी दिलं होतं बेंडाळे सरांनी मला बनवून 1 किलोभर बनवून दिलं. भरपूर वापर चला, ते अजून थोडं शिल्लक आहे अजून. क्रव्याद्रस, मेद, शिलाजतू, आरोग्यवर्धिनी, मृत्युंजय रस, गंधक रसायन. ऑल दीज आर द मेडिसिन्स विच कॅन बी ऍक्टिंग. अस्थि नाग भस्म ताप्यादी, and even panchatikta grata guggul can act on asti majja gatvat. So that's why it is there. So majja. So therefore all this, when it becomes important, the cancer has spread to multiple places. So now what? So which are the medicines which are covering? Suppose Yakrut, liver is affected, bones are affected, and lungs are affected. So what is common in them? So Rakta, one is common. So which medicines will be covering all these sites, or at least few combinations which will cover all these sites? Like that we have to think. Majja, Raupya Basma and Abrak Basma, Shukra, Vanga. Chandraushu Ras is very wonderful combination of Vanga and Gandhak. And that's why it can control Vikrut. Vriddhi Lekhan can also take place by Gandhak. At the same time, Vanga will give birth to Shukra, and Vanga is acting on Shukra Dhatvagni. Why I am saying this? Because see Gunakarma of Vanga, Vanga Tikta Ras, Tikta Kashaya Ras, Lagu, etc. How it is giving nourishment to Shukra then? Samanya Vishesh Siddhanta is there. So how Vanga will give nourishment to Shukra? So we can conclude that Vanga is improving Parinaman of Shukra. So if Shukra related, then Vanga will have to. So this list is important. So when we use medicines accordingly, we can immediately make changes in the Parinaman. That means we may say metabolism of that particular dhatu. And therefore we can correct the formation of that dhatu, and that's why abnormalities will be controlled and good quality dhatus will start producing. So that's why this is important. Next. So as I said, Arbut cannot be the diagnosis of all the patients. Practically, we have to see that in this patient, what can be my diagnosis? If I was not knowing anything from modern medicine, suppose, then what I would have diagnosed. So Rajakshma, in many patients, it can be diagnosis can be Rajakshma, Srotorod Janya. That means because of Srotorod, Rasa Dushti takes place, and from Rasa, Parinaman of Rakta and further dhatus is not taking place properly. That's why Pandu. This kind of Pandu. Then Grahani, in many patients related to intestines, cancer, Grahani, that can be the diagnosis. Rakta Pitta, Kamala, Arbud, Gulma, etc. can be the diagnosis. Next. Now, this was the theoretical part and important concepts. Some students, specifically who are newly started thinking in Ayurvedic terminology, they may think that ये तो बता दिया इसका क्या practically क्या है इसका उपयोग. तो ये remember this, and this will be useful for you when a patient comes to you if you will remember this. So the same thing is applied in these patients. So few cases I am presenting here. One 45-year-old lady, her symptoms were Vaivarni on Prushtha, Twakdalan. So she was diagnosed as having psoriasis according to modern this thing. Shirobhumi Kandu, Twakdalan. Next. And she was in 2014 June, she was diagnosed as having high grade diffuse large B cell lymphoma stage 4. This is not the case which is published in the international journal. Many cases of diffuse large B cell lymphoma and other lymphomas are coming. Recently, one boy of 14 years, he was being treated at Tata Memorial Hospital for 3 years, but recurrence was continuously there. Now, last around 1.5 years, there is no recurrence. He is having Hodgkin's lymphoma. So, like that, in such patients. So, this patient, 2014, already stage 4 was mentioned, and high-grade diffuse large B cell lymphoma and psoriasis. That was her diagnosis. In addition, she was already having schizophrenia since 20 years, and she was undergoing treatment for that. So under control, but she was having schizophrenia. So her brother was bringing her for the treatment. Next. Now see the list of lymph nodes present in our body when we started our treatment. It's a big list. Continue. There is a big list of which lymph nodes were present in the body. There is a list of all these lymph nodes. Next. Next. Various parts of the body. So many lymph nodes abnormally increased. Next. Next. So all this was the big list of all the lymph nodes enlarged in her body. And these are her, although it may not be visible for you, but I have highlighted certain parts. Next. 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 She was diagnosed at Tata Memorial Hospital. Next. And then they decided that they will take only Ayurvedic treatment for this purpose. Next. 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 Important parts I will tell you. Examination according to Ayurvedic Parikshan. Vyan and Apan were mainly involved initially. So I told importance of Vyan Vayu. Talarudaya indicating that related to mind, this Nadi, Talarudaya Nadi. Man and Angushtamul Parvat is related to Shukra and Oj Nadi. Yeah. So in that we have to understand that Shukra Kshay is also there and Ojakshay is also there. Netra Pandutva, Atikarsha. So her diagnosis from our point of view was Rasadushti and Pandu. And then Roksha at different level of different dhatus, it appears in different ways. At the level of which dhatu Roksha is there, that we can identify by observing it. Normal Roksha at skin, everyone can understand, but Roksha related to different other dhatus, Rakta dhatu, Maus dhatu, Roksha related to those dhatus can be understood that way. Next. So accordingly now Rasadushti was there, therefore Suvarnamalini Vasanta, which will be acting on Rasadhatvagni and Hirak, that was started, and Mahatikta Gruta because it will act on Rasadhatvagni, Rasarakta Maus Med, on all these Dhatvagnis it is acting. And additionally it will be acting on the skin problem of her. Then in such patients we want quickly to improve the functions of Agni, so that because Dhatvagni are dependent on Agni, so that's why we want to quickly improve the functions of Agni. Agni is present mainly in Grahani. Grahani is the main site, and that's why Parpati Kalpana, which is acting directly on Grahani, it increases bala of Grahani. Bala of Agni is also quickly improved when Parpati is given. So Panchamrut Parpati was given to her, and you can see that it was given in Samankal, so that it will specifically act on that site. Tripala Raktapachak and Dhamasa, like that we are giving for Pachana and Anuloman. And Raktapachak when it is given in Samankal, Raktadushti and related to Rakta different organs, again think. On that also at the same time it is acting. Tapyadi Loha, so that this Parinaman from Rasa to Rakta will be improved, and also Parinaman of Med will be also improved. Gandak Rasayan, Rakta Dhatvagni Dipan, and also acting on that skin problem. Rasa Manikya is a very wonderful medicine, and it is also Vat Kapha Shamak, Rakta Dhatvagni Dipan, Guduchi Haridra and Vanga, like that it was given. Initially Krumikutar Kampillak was given and Udvartan. Next. Under Parikshan, okay, this was the next time what was the Parikshan. Next. So in Parikshan also improvement was observed. Next. So since then she is under our treatment till date, now also. Without any modern treatment, she is under grade 4 diffuse large B cell lymphoma. Now also she is under our treatment, but other factors are also working over there. That means her brother, he was taking care of her, no, that lady. So what we understood, that probably they were thinking her as a burden, that always I have to spend money for her, I have to spend time for her. So maybe whatever reasons, they were never regular in taking medicine. So we call that certain patients, they are such patients that to the whole medical system, they are making क्या तुम लोग बोल रहे हो डिफ्यूज लार्वल, हम लोग तो ऐसे मेडिसिन लेंगे फिर भी ठीक हो जाएंगे. So still that means after they will take medicine for 15 days and will come after 1.5 months or 2 months. Again they will take, like that they have taken the medicine. Still she is well improved. That skin problem is also improved. Even in schizophrenia also a lot of improvement is there. She sits along with the family to see the TV serials and all. If someone comes to house, she brings water, please sit down, like that she talks to them. In that also improvement, because Ojvardak medicines are there, Suvarna Malini Vasanta, etc. That's why it happened. And then because of this reason, they were reluctant to take reports regularly. They were not ready. No, just give medicine, next time we will come with the report. Every time they will say the same thing. So after a long period, he was well, but we insisted now, if you will not bring the report, we will not give you the medicine. Then they went to Goa Medical College Hospital to take the reports. And first of all, the doctor who screened her for that, he was very angry. And he told that, are you a fool? You are taking Ayurvedic treatment? मरना है क्या? अकल नहीं है क्या कोई? ये ले रहे हो तुम लोग? तो वो बोले ठीक है, वो सुन लिया उसने, उनके भाई ने. Then next day he went to collect the report, and in the report almost all the lymph nodes, they are gone. Only 1 or 2 small lymph nodes were remaining. That's why they are remaining, because she is not taking the medicine regularly. Still majority are gone. Then the doctor next time. Next, I have highlighted part. Next. I have written what was observed in that report. Next. Last 10 years now have passed almost. Means 10 years will be completed in June. Still he is well. And next day when he went to collect the report from that doctor, he said, this brother of this patient, डॉक्टर कल आपने बहुत डांटा मुझे, वो तो बात ठीक है, लेकिन ये बहुत इतने सालों से आयुर्वेदिक ट्रीटमेंट पे ही और ठीक है वो. और तो वो भी बात देखी डॉक्टर ने और रिपोर्ट भी देखा. डॉक्टर बोले कि कौन से डॉक्टर है? दी क्या है? बोले उनका एड्रेस दे सकते हो, मेरे एक रिलेटिव है, उनको भी यही प्रॉब्लम है. तो वो उनको एक फोन नंबर वगैरह दे के आए वो लोग. नेक्स्ट. So many diffuse large B-cell lymphoma cases and other non-Hodgkin's and Hodgkin's lymphoma cases, one of them I have presented. Now next one case, one 57-year-old male patient. He had main symptoms were Kanthadaha, Amlika, Baddhamal Pravartan, Udgar Bahulya. Next. Vibaddhamala, Asamadhankarak. Next. His modern diagnosis, initially he was diagnosed with CA esophagus and then metastasis to liver, and they will give chemotherapy to him. The size will shrink, and then when the chemotherapy is stopped, after 1.5 months or so, again same size. Again after some days they will start chemotherapy. Like that 3 times it happened before, and then they came to us. Next. These are his reports. Next. This was his parikshan. So why Bhasma Varna Upalek indicates long-standing ajirna. Udarlamban Vam Kukshi Vangshan Admadhvani specifically. So that indicates that Malapravartan is not proper. Then that happens here. In which part of the abdomen we get Admadhvani or pain. Accordingly also we can understand specific things. So that way. Nasagra Prututva. By performing Nasa Parikshan also we can understand about various Dhatuvagnis. So Nasagra Prututva here was indicative of mouse Dhatuvagni Mandya. Prabhani. Next. So according to his condition, Hirak Rasayan, and now since he is present over there, I can openly say that all these Rasayan are from, Rasayan means from Rasayani. we are taking. Not because I am having any agreement with them, but because of the good quality. If someone can show me better quality if some other company is having, I can shift to them also. But up till now, in last 28 years, I am believing them because I have actually gone there and seen how they are preparing, and my experiences also tell that they are very effective. So I am sticking with them. Not just because Vaidya Benda is my friend, but because of the good quality of medicines. So when he was preparing on his own with a kharal in a small room. That time only my first purchase was from him. When I started practicing in Goa, that time he was in Panalir or in doing internship. So that time only I purchased from him. Till that time, now also we are purchasing from them. And here now, Raktapachak, Dhamasa, Brungaraj, Sajjikshar. I will not go in details of all the mode of actions of all these medicines because it will take a long time. But Brungaraj is Kshardarmi, and that's why it is opposed to Amlatva. So Amlika Rutkantada. And Brungaraj, it Vaidyas say that it can be found anywhere near a gutter also. So from that dirty water also it is having the capacity to take good quality so that it can survive and thrive like that. So that means it is having the capacity to make Sarakikta Vibhajan better and remove malas out, throw malas out because of Saraguna which it is having. So that's why that was used for him. Tapyadilo Navya Sudshekar is a specific preparation prepared by Vaidya Gayakwad from Solapur, and in that, apart from all the part of Sudshekar, more medicines are added. No changes are there, additions are there, so that it will be even more useful. So in that Kukkut Nakhi is there, Jhar Mohra Basma is added, and one specific plant, Brahmadandi, its Mool, it's added, and Manganese Basma is added. Why he has added? He has written a book on that. So it is used, and Kukkut Nakhi separately again it was used because it controls Gati of Vat and it performs Lekhan of Vikrut Vritti, but Vat Shaman also it performs, and it is Medhya also. Now another concepts are also important. Once a discussion was going on in a group of Vaidyas, and one junior Vaidya asked a question, and then again he wrote that please write which medicines to give, no concepts please. So that is true when a patient is sitting in front of you and he is having emergency, but otherwise why the other Vaidya suggested a specific medicine to him? Because he had good concepts in his mind. So concepts are for long term, we should be knowing concepts. And if you don't have proper concepts and the patient is sitting in front of you, ask experienced Vaidyas and temporarily treat that patient accordingly. Then try to think why he has suggested these medicines for this patient. So, Kukkut Nakhi is also Medhya. So, I was telling that this Jamadagni sir is also telling that Smrti is very important. So, and it is present in each and every Paramanu of our body. That means we may say cells. And because of that, that cell develops in a specific way, and it is programmed that it will be dying at a specific time. So, but that Smriti is having Vikruti, and that's why that cell is not dying. Like that also is his interpretation. And then cancer occurs. So that's why Smriti, improving Smriti, Avayava Smriti is very important as per him. Kukkut Nakhi is also Medhya, acting on that also. Rohitak, already I have mentioned. So these medicines, that means now here Rakta was important Dushya because Yakrut was involved. And how the Samprapti occurred? Recurrent Ajirana due to that Rasadushti, and due to that Vikruti was passed on to Rakta. And that's why Vikrut Rakta, and that's why Vikrut Rakta Vriddhi, and therefore abnormal growth in Rakta. So that's why this way it was given. Next. So I am making it short. That means all these reports I am not going to read. So we continued his treatment. Symptomatically also he got relief, and subsequently in the CT scan reports also no growth was observed. He continued the treatment for around 2 years, and then he started thinking this is one problem, that patient, now I am alright, why the medicines are continued for me? So, but Rasayan are to be continued for a longer period. So he thought that now I am alright. So he stopped the treatment without informing to us. But by that time, 3 times at least CT scan reports were taken and no recurrence was there. Then he stopped the treatment. After that also, because since he was staying in the same place, Ponda, so I knew about him. For 3 years I had seen him He was well, but then what happened, I don't know. Last year he expired, but how he expired, details I am not knowing. Maybe it recurred again or what, I don't know. But at least for that means 5 years he was very well and without any recurrence. Although he stopped the treatment after 2 years. Next. Now this one lady, she had 64 years of age and her symptoms were Adhodar Shul, Udar Gaurav, Shudha Mandya, Bharakshay, and then she was detected as having CO of ovary and endometrium in 2017. Next. Baddambala Pravritti, Adman, Udar Gaurav, Kantobale Pratiti, Anga Ushne Pratiti. That means Ajirana and many symptoms related to Rasadushti are observed here. Due to Rasadushti, Vikrut Kaf Utpatti, and that's why Kantobale. And due to Udavartan also, patients feel Kantobale. Kantobale patients are feeling, we give them Calmake strong liquid and that Kantobale is relieved. Why? Because the Vikrut Kaf is also reduced and Udavartan is taken care of that. And Krimi. So, Anga Aushne Pratiti. Jwara is mentioned under Rasadushti. Every time we don't observe exactly Jwara, but the patient is feeling Aushne. That also can be the presentation of Jwara in Rasadushti. Next. And she was also having Ubhay Prapad Tivra Kandu and Twak Dalan Vicharchika like presentation. Now, one thing I will mention that before coming to my clinic for this purpose, for that skin problem, in the past she was taking treatment from Bhagwat sir. And one wonderful thing which I noted, that she was having skin problem on the feet, also on the palms. So Bhagwat sir applied leeches, Jalauka on the foot. With that, not only she got relief in the symptoms related to foot, but in palms also she got relief. So I said that Bhagwat sir ka chamatkar dekhiye. That means actually चमत्कार of आयुर्वेद. पैरों में जो लोग लगे हाथ भी ठीक हो गए. सोचो तो ये आजकल क्या है कि आयुर्वेद की जो शारीर है, many people are writing articles or on social media continuously they are writing that it is obsolete, it is outdated, it is should be thrown out and only modern anatomy physiology should be done. We just laugh at them because in every patient we require Ayurvedic sharir for treating that patient successfully. Without Ayurvedic sharir, can you give any justification that पैरों में जलाव का लगाने से हाथ में कैसे ठीक हो गए? आयुर्वेदिक शारीर बताता है कि ये दोनों रक्त सार में ये दोनों का संबंध आता है, तो रक्त से दोनों कनेक्टेड है, इसलिए वहां से रक्त दुष्टि दूर की तो यहाँ पे भी थोड़ा असर हो गया. So without knowing Ayurvedic sharir, we cannot give justification to that. So Ayurvedic sharir is very much important and it is very much applicable at every step, on every patient it is required for us. So if you don't understand, just remember it and you will start understanding it and its applications afterwards. So ग्रंथों में शारीर पूरा नहीं दिया है, तो जो हैरिसन्स और डेविडसन्स है इसमें पूरा ग्रेज एनाटॉमी होता है क्या, या उसमें पूरा गाइडेंस फिजियोलॉजी मिलती है उसमें? तो इसका मतलब है हैरिसन और डेविडसन्स के ऑथर्स को एनाटॉमी और फिजियोलॉजी का पूरा ज्ञान नहीं है, क्योंकि उसमें सारी एनाटॉमी फिजियोलॉजी कहाँ दी है उसमें. तो इसी तरह से एक चरक संहिता इज अ बुक ऑन चिकित्सा. अष्टांग हृदय इज अ बुक मेनली डिवोटेड टू चिकित्सा, अष्टांग बट मेनली चिकित्सा. सुश्रुत संहिता is mainly devoted to Shalya. Why they will give whole anatomy and physiology over there? So they have given only applied anatomy and physiology. So whatever is given there, it is applicable immediately, clinical, everything. So that's why we should remember that. Further details are given in modern anatomy and physiology. We welcome that. We will read that also. But this is very important for clinical applications. Next. And she was complaining of Yonigat Jalavat Shvetasrav, and so much that she had to use pad for that. Yoni Kandu. So all these were related to Rasa and Mausa Dushti, mainly all these her symptoms. And she was in November, she was operated for that. And after that she was advised chemotherapy, radiotherapy, etc. Next. But she approached for Ayurvedic treatment. So again, all these parikshan, I will not go in details of that. But recurrent ajirna and Adman Udavartan were present in her body. Next. Ganda Shoth indicating recurrent ajirna and even mouse dushti. Nasagra Prututva indicating mouse Dhatvagni Mandya. Prabhani. Mouse Sthan, in that Mardhav and Shaitilya was there. That means mouse was having Shaitilya. Next. These are her reports. I will not go in details of that right now because she had undergone operative. So at that time specifically any growth was not there. But she had not undergone chemotherapy which was advised for her. This was a report of biopsy that she was having adenocarcinoma of ovary and even the uterus was affected, endometrium was also affected. Next. So treatment for that, again here Rasa and Suvarnamalini Vasanta is also having Marich acting on mouse Dhatvagni also. So Rasa and mouse Dhatvagni. So Suvarnamalini Vasanta was selected here and Hirak Rasayan. And Chandraprabha, Chandraunshu was here given because for specifically acting on ovary and uterus, and Chandraprabha, Raktapachat, Brungaraj, Dhamasas, Sukshmatebala, like that it was given in Apan Kal so that it will be specifically acting on those organs in Apan. Next. And in Vyanudan Kal, Navya Sutshekar, Kanchanar Guggul, Vakerilo, Kasis, like that a combination was given, and Rohitakarishta to avoid recurrence and metastasis. So with this treatment, next. Symptomatically, immediately improvement was there. Next. Symptomatic improvement. She continued the treatment for around 2 years. That means she was, her family background was such that she was not from a poor family as such, but she and her husband, they have dedicated their life for social work. So they are working without a salary for that. There is only just food and basic facilities they will get. They are not as such getting salary. So it was very difficult for them, as it is in Goa. PET scan is not available, but even CT scan also they were not affording, and that's why they were hesitating to go for that. But she was symptomatically well, and then we took the reports. Next. So we continue. Next we added Chaturmukh Ras later on, because from Grahani Dushti, if Rajakshma takes place later on, then specifically Chaturmukh Ras is selected. So here also Ajirana, and from that Rasadushti and Rajakshma like conditions. So for that purpose we give that for a long term. Then next. So next. Once only she took the report, and I will highlight. So here no recurrence was observed. Once when this PET scan she did, she went outside Goa and she did. No recurrence was observed. Next. And then, as I told, she was very reluctant. So she was well. So at least take USG, but in the, later on in the USGs, no growth was observed. Now, after 2017, now it is 2024. Around 10 days back also she visited our clinic for some other purpose. That means for her daughter, actually. So still she is well without any chemotherapy or radiotherapy. So that also can happen. Like that, certain patients are there, their records, and we have observed them over the years. Not immediately we have told that, okay, they without chemotherapy and radiotherapy they are well. We observed them for 5, 6, 7, 8 years, and then we are making statement that yes, they are well, and reports were taken recurrently, and again in that also nothing was found. So now we can say that they are free from that disease. Now in the USG only this one came. So for that certain treatment was given, nothing else was there. No growth, abnormal growth. Next. So instead of chemotherapy or radiotherapy, now all this what I am telling, that we decide based on what experience we have, what we know and what we can do, that we have to consider. we believe that Ayurveda is having potential to do everything, but we also know that I am not knowing whole Ayurveda. I am not mastered all the Ayurveda yet. So whatever I know, based on that, what I can do. If for the benefit of the patient, we have to work. We should be having agraha for Ayurveda, but not duragraha. Depending on the condition of the patient and whatever is good for the patient, that advice we have to give. One patient was having dysgerminoma of ovary, and they wanted to take Ayurvedic treatment, but in the treatment of that dysgerminoma, it was mentioned that 94% positive results are obtained in those patients. So I told that better you go under that treatment, and then to avoid recurrence we can give Ayurvedic medicine. So they were ready. So I could have agreed, okay, so they are ready, so we will start our treatment. But 94% results are there, and I was seeing the first patient of dysgerminoma. So instead of taking it, I asked them that you undergo that treatment and then we will start our treatment to avoid recurrence. So for the benefit of the patient, whatever is required, that way we have to think. So in all the patients, we will not advise immediately to avoid chemotherapy and radiotherapy. Why in these patients we avoided? There are reasons for that. So based on our capacities, we have to do it. We'll have to do it, and then we have to increase our capacity, our knowledge continuously. So, but whatever we are doing, it should be beneficial for the patient ultimately, by Ayurvedic treatment or whatever treatment it is, but it should be ultimately beneficial for the patient. So last 7 years she is having good quality of life, no recurrence is there, and symptomatically also almost complete relief. That means why almost? Because sometimes she gets itching again after the seasonal changes. That's why not complete relief, we can say. So I shared some important thoughts related to cancer and some clinical experiences about certain patients of cancer. And ये है ना कि जो मतलब हमें ऐसी कोशिश करनी चाहिए ना कि हमेशा साइड रोल ही मिलेगा हम लोगों को. मतलब ये जैसे ही तूने बताया कि वो लोग ट्रीटमेंट देंगे और उसके साइड इफेक्ट्स हम लोग ठीक करते रहेंगे. म्हणजे दुसरा जेवला आणि त्याचा आपलं ताट बेटा आपण उचलायला आपल्याला ठेवल्यासारखं येतं एक प्रकारे. सो वी शुड बी ऑल्सो इन लीड रोल्स अँड नॉट फोर्सिबली और विदाउट नॉलेज, बट वी शुड इम्प्रूव्ह आवर नॉलेज इन सच अ वे दॅट वी शुड गेट लीड रोल. So all these cases which I have presented here, only Ayurvedic treatment was going on. So whatever results are there, credit will go to Ayurveda. Otherwise they will say, many people are presenting cases that modern treatment was also going on, Ayurvedic treatment was also going on. They will say that it is due to our treatment. Your treatment was just having placebo effect. Patient was feeling good with your treatment, but actually what was the result of your treatment? But in all these cases, only Ayurvedic treatment was going on. So we can definitely say that the results were due to Ayurvedic treatment. So by making study and properly, we all can become capable of treating such patients, and that is the aim of this CME. So you take one step forward, try to improve your knowledge, and you can also treat the patients. And if all of you will do that, it will be very much beneficial for the society. So that's why we have to do it. So with these words, I thank Ayurveda Vyasapith Goa to invite me, although I'm not a guest for them. घर की बात है सब. So thank you all of you for patient listening. Thank you very much.